Hello, I am Professor NP, and today we're going to talk a little bit about the widowmaker. Now, a lot of times we hear this word, we don't quite understand what it means, so I'm just going to give you a quick, brief overview. So, when you think about the heart, look at it this way: this is the heart that is facing you, okay? The apex of the heart kind of lies on the left side of the sternal border in the fifth intercostal space area, okay? So, we have two major coronary arteries. You have a left coronary artery, which is also considered to be the left main coronary artery, and then you have the right coronary artery. Okay, so let's stick with the left side for right now. So the left main coronary artery branches off into two. So understand that your left coronary artery, it supplies oxygenated blood to the heart. It originates in the aortic area. It has branches in itself. So think of the blood vessels to the heart as like branches on a tree. Okay. So you have your left, your LCA. Okay. It branches off into your left circumflex artery, also known as the LCX. As you can see, it branches off here. And what the LCX does is it supplies blood to the left side of the heart, kind of like towards the back of the heart. Okay. And you want to keep in mind that this also branches off into other blood vessels as well. So your LCX, which is your left circumflex artery, it also has a branch. It branches off into the left marginal artery, which is what we also call is the obtuse artery. And as you can see, the left marginal artery, think of marginal, okay? It runs along the marge or edge of the heart toward the apex. As you can see, location wise, it is located in the left atrioventricular sulcus area of the heart. So it supplies blood to the left ventricle. Okay, so you want to make sure that you keep that in mind. So let's go back to our LCA for a second. So remember I talked about how your LCA actually branches off into two, which we already said it branches off into the LCX, but it also branches off into your LAD, and that's your left anterior descending artery. So as you can see, this is your LCA, and this is your left descending artery, okay? Now, when you think about it, think of it this way. This artery is the major artery that supplies about 50% or more blood to the anterior side of the heart. So your LAD, as I mentioned, supplies 50% of the blood to the heart. And what you also want to keep in mind is that this is what we consider the widowmaker, okay? Because it is supplying blood pretty much to all areas of the anterior aspect of the heart, okay? And when it becomes blocked, funeral arrangements are potentially going to be needing to be made. So your LAD has two branches. Remember I said you have to think of the blood vessels as branches, like on a tree, right? So you have your LAD that branches off into two branches. One is the diagonal arteries. Your diagonal arteries are going to supply blood to your lower ventricles, okay? The pumping chambers of the heart. Then it branches off into the septal arteries, which I don't have posted here, but the septal branches supply blood to the septum of the heart. And if you remember, the septum of the heart is what divides the left and the right side of the heart. And then you have your right coronary artery. Your right coronary artery supplies blood to the right atrium, the right ventricles, the SA node, and the AV node. Okay. And you also have to keep in mind that your right coronary artery also branches off into the right marginal artery, and then your posterior or PDA, posterior descending artery. And I don't have that picture here because it wraps behind the heart, and what you're looking at right now is the anterior aspect of the heart. Although all these branches, you have to remember all of your blood vessel branches connect to each other, okay? So your right marginal artery, basically it supplies blood to the right ventricles, and as you can see, it runs along the edge toward the apex of the heart. LAD is your widowmaker. Try to eat healthy, walk, exercise so that no one have to make funeral arrangements for you. Like and subscribe.